Welcome to Virtue Podcast, powered by Azkka Pharmaceuticals, India's first company to bring evidence-based flat pricing in medicine. Virtue Podcast brings in renowned healthcare experts as we explore the path to healthier living, where science meets virtuosity. Tune in to YouTube, Instagram, Facebook, and Spotify as we welcome our virtuous guest. Don't forget to subscribe, hit the bell icon for the latest updates, and leave your comments.
What daily habits or lifestyle changes are truly important for keeping our heart healthy?
A very basic thing to keep a healthy heart is you should have some form of exercise at least 5 days a week. Especially for those who are already having high cholesterol levels and for those who are having a family history of early heart disease, I recommend to use extra virgin olive oil in their diet. What studies have shown that's like almonds and walnuts, these are very good to keep your heart healthy.
They don't know how heart problems affect women specifically and why they are sometimes missed or misdiagnosed to an extent.
Once you have crossed the 40 years of age, whether you're male or female, you should get your cholesterol levels, your lipid profile done, your ECG, echo and TMT.
Right.
If this much you do, your heart disease won't get missed. आपके वॉल्स में ब्लॉकेज है या आपके वॉल में कोई लीकेज है, ये आपको एकोकार्डियोग्राफी में पता चलेगा. और ये अगर आप अर्ली स्टेज पर डिटेक्ट करोगे तो ये मेडिसिन से ही कवर हो जाएगा. वो स्टेज प्रोग्रेस जल्दी होगा नहीं. और अगर आप मेडिसिन उसको अर्ली स्टेज पे नहीं स्टार्ट करते हो तो वॉल रिप्लेसमेंट का स्टेज बहुत जल्दी आ जाएगा. टूडी इको विल टेल यू आपका हार्ट का पंपिंग नॉर्मल है क्या और आपके वॉल्स नॉर्मल है क्या. हार्ट का पंपिंग, जब तक आपको हार्ट अटैक नहीं आएगा तब तक आपका हार्ट का पंपिंग नॉर्मल ही रहने वाला है. अगर आपको वॉल का प्रॉब्लम नहीं तो आपका वॉल नॉर्मल ही है.
Ma'am, another important issue for women is gestational diabetes during pregnancy. So could you explain what exactly it is, how it affects both mother and the child, and whether it has any long-term impact on mother's heart health?
How much diabetic diet you can follow that will be better for your heart.
Yeah,
Because once you develop diabetes again, there will be always a 10% risk that mother will develop in future again diabetes. In heart there are 3 important blood vessels, 2 on the left side and 1 on the right side. So in 4D dimension, it will tell you which part of your heart is under strain, means where a significant blockage is there, whether it is on the LAD territory, L6 territory or RC territory. That the whole thing that GLS will tell you. So routinely I do global longitudinal strain in my all echocardiography patients. So on echocardiography only I can tell them whether you are having a significant coronary artery blockage or not.
Hello everyone, myself Dr. Shradha Runwal Gadiya, consultant interventional cardiologist at Dr. Runwal's Rhythm Heart Care Center, Aurangabad. I and my brother Dr. Shreyas Runwal, he is cardiothoracic surgeon. We both have started this institute at Aurangabad. It is a 50-bedded dedicated heart center, and the only motive of this center is that every cardiac patient of Marathwada region should get the advanced cardiac facility in the time required.
Welcome to yet another episode of Azkka Virtue Podcast. We often take health symptoms for granted until a problem arises. As the saying goes, prevention is better than cure. Today, we have with us Dr. Shradha Runwal Gadiya from Chhatrapati Sambhajinagar, Maharashtra with us. She is the first woman BM interventional cardiologist in the Marathwada region, a gold medalist in cardiology. She has performed more than 550 transradial robotic angioplasties and currently director and senior interventional cardiologist at Dr. Runwal Hridayam Heart Care Center. Dr. Shraddha will help us understand how to care for our hearts better, especially for women, and what steps we can take every day to stay healthy. Thank you so much, ma'am, for joining us for this wonderful conversation, which I am looking forward to because this is the first topic that we have, which is specially oriented towards women. And who better than you for this? So, welcome, ma'am.
Thank you so much.
And I'll move right into the first question. We all want to have a healthy heart. ये सबका एक सपना है कि heart healthy होना चाहिए. But many of us don't know what exactly this means.
Right.
So to start with, मैम आप थोड़ा हमें guide कर सकते हैं कि what daily habits or lifestyle changes are truly important for keeping our heart healthy.
First of all, a very basic thing to keep a healthy heart is you should have some form of exercise at least 5 days a week. Just a medium intensity exercise of 30 minutes per day, just 5 days a week if you perform, this will help you to keep a long-term healthy heart. Right? Exercise can be any form what you like. A simple walking, a jogging, a swimming, a badminton, squash, tennis, whatever sort you like, some sort of exercise will help you to keep a healthy heart. Second and foremost thing, what we daily see is your daily lifestyle. Lifestyle is changing nowadays so fastly that everyone wants preserved food, fast foods, packed foods. So all this is going to increase your cholesterol levels. The oil definitely which is used in a ready-made food is not going to be of that great quality as your home cooked food is going to be.
Right.
And which oil should be used. This is also important to keep your cholesterol levels and keep your heart healthy. So, especially for those who are already having high cholesterol levels and for those who are having a family history of early heart disease,
Right.
we recommend to use extra virgin olive oil in their diet. So, routine use of extra virgin olive oil quickly helps to keep your cholesterol levels under control.
Okay.
Then you should avoid oils like, palm oil, coconut oil. So, these are harmful oils. Then you have hydrogenated a fat like, a dalda ghee. All these stuff if you avoid and decrease the amount of fried foods in your diet. It cannot be stopped definitely, but you should decrease the amount like 15 days a month. Like that you can have. Right? And there is some misconception like, ghee is, homemade ghee is very good for heart. So whether it is ghee, whether it is oil, whether it is homemade or it is ready-made, the content is ultimately fat. Okay. So your both ghee and oil content should be reduced in your diet. What studies have shown that's like almonds and walnuts, these are very good to keep your heart healthy. Okay? It's about dry foods. Second is fruits. You should increase the intake of fruits and fibers in your diet. So this will help you to keep a healthy heart. For the patients who had hypertension patients, your blood pressure के patients होते हैं, the salt intake should be reduced. This is very important. What we recommend is their salt intake should be less than 1 gram per day per person. This much less should be the salt intake. So for hypertensive patients, if we just reduce the salt intake, ऊपर से नमक नहीं लेना है. Pickles, papads, all these stuffs, they have, these are preserved foods, they have salt in them.
Right.
So that consumption should be reduced. So this will help you keep your blood pressure levels normal. Okay. Only just a reduced salt intake and a daily walk of 30 minutes. If this much a hypertensive patient does, it will help his blood pressure to reduce by 5 to 10 millimeter of mercury.
Okay. Okay. So I think that's really helpful what you have shared, and you have simplified it for all our viewers. So I think what I gather from what you have just said, that these are all small daily choices which makes a lot of difference. I mean, like food, exercise, or to an extent even stress control, which really makes a big difference.
Yeah.
So a consistent and small choices is the key to maintaining a healthy heart.
Exactly. Annually, after age of 40 years, whether you're male or a female, everybody should get a regular heart checkup done. A simple checkup which includes a lipid profile, that is your cholesterol levels. Second is a ECG and a 2D echo and a stress test or a 4D echo. For those who cannot walk on a stress test, instead of 2D, we advise 4D echo with GLS, that is a global longitudinal strain. So only this much, it will hardly take your half an hour, and your complete health, your complete heart checkup is done with these 4 tests,
Right.
which includes a lipid profile, ECG, a echo, and a TNT.
Okay. Okay. So I think apart from the small choices that we make, a regular checkup, I mean, we need to get it done irrespective whether you are facing any trouble
Exactly.
or not. I think after a certain age, ma'am, what is a certain age that you would define?
After 40 years.
Okay. So
Yes.
post 40.
And there's some misconception. People just do, in the name of whole body checkup, they just do the blood tests, a list of blood tests, and they think the checkup is done. So, as far as heart is concerned, the only main important in your blood test is your HbA1c levels and your cholesterol levels. Rest your blood test won't tell you whether your heart is healthy. For that, you always have to do a ECG, a echo, and a TNT.
Right.
And why people get a sudden heart attack? Because they don't get their annual health checkups done.
Right.
A person gets a heart attack only when his coronary artery gets 100% blocked. So you don't have to reach the state of your artery getting 100% blocked. If you do these annual checkups routinely, and if you're at the percentage of 50 to 70% only, if these blockages are detected at 50 to 70%, then we just start them the medicines, which will help you to keep your heart healthy and prevent the progression of your heart disease. And if it is between to 70 to 90%, we recommend angioplasty or bypass surgery. So you won't reach that stage of getting a heart attack.
Right. Right. So then somebody with already, a history of heart disease in the family, any particular age you recommend that, they should get their heart health checked
Yes.
a bit early maybe then?
Yes, like 35 years or so we recommend.
Right.
And thus also there are specific blood tests for familial history of heart disease. So these includes your apolipoprotein levels, your levels of lipoprotein A. Levels of lipoprotein A tell you a lifetime risk of getting a cardiovascular disease. Okay. And the third is a homocysteine levels. Familial hyperhomocystinemia is becoming very common nowadays. So if your homocysteine levels are high, you can start the medications at an early stage, which will prevent the side effects of hyperhomocysteine, which is nothing but your blood getting clot, and you may get the cardiac issues. And for those who are having family history of dyslipidemia, that is high cholesterol levels, again, getting your complete lipid profile levels is
Okay.
so your LDL cholesterol is the bad cholesterol, and your HDL cholesterol is the good cholesterol. So it's only the HDL cholesterol which should be on higher side. Rest all should be within your range. Nowadays, because of this lifestyle changes, we often found high triglyceride levels in people. Only the triglyceride levels are raised. So if this is detected at an early stage, we can start with the medicines which will prevent the deposition of cholesterol in your coronary artery disease.
Right.
And along with that, we start them with a healthy lifestyle, and then slowly we stop the medications and keep them on a healthy lifestyle.
Oh, okay. That's interesting. Huh? So, ma'am, we often hear that women show very different symptoms when it comes to heart disease as compared to men, uh, and this is something which is a topic which has not been much covered about or talked about.
Exactly.
तो क्या हम आप एक्सप्लेन कर सकते हैं that how heart problems affect women specifically and why they are sometimes missed or misdiagnosed to an extent.
First of all, women themselves, they don't take care of their heart. They are all the time to take care of their family health. So this should not be a neglected part. As I say, once you have crossed the 40 years of age, whether you're male or female, you should get your cholesterol levels, your lipid profile done, your ECG, echo, and TMD.
Right.
If this much you do, your heart disease won't get missed.
Right.
Right? Now, what happens specifically in females when they go to a stage of pregnancy? Uh, some um, some patients develop gestational diabetes.
Right.
Now, once a patient develops gestational diabetes, there is a lifetime risk for her to become a diabetic again. Always there is a 10% risk.
Right.
So, it will not be with every gestational diabetes, but 10% risk is always there. So, it is, if you have such a history, you have to get your annual HbA1c and fasting post-meal sugar levels done. So, this will avoid the long-term side effects of diabetes on that patient. Similarly, thyroid. Many females, they develop hypothyroidism in pregnancy. So, again, it may convert into a long-term hypothyroidism. So, annually, you have to get your thyroid levels checked. That will avoid the long-term side effects of hypothyroidism on your heart.
Okay.
Third, there are because if you don't get your echocardiography done, certain things gets missed. Um, like in pregnancy, there's a uh, entity called as peripartum cardiomyopathy. So what happens in this कि हार्ट का पंपिंग आपका कम हो जाता है प्रेगनेंसी में जो ओवरलोड आता है फ्लूइड ओवरलोड आता है बीपी बढ़ जाता है उसके वजह से जो हार्ट पे ओवरलोड आता है सो दैट डिक्रीजेस द पंपिंग ऑफ योर हार्ट तो इसका अगर हम टाइमली ट्रीटमेंट करते हैं देन इट मे अवॉइड द लॉन्ग टर्म की आपका पंपिंग long term में अच्छा रहे. So early detection is very important in all these things. Similarly, rheumatic heart disease is also common in females rather than males.
Okay.
So अगर आपको थोड़ा चलने पे दम लग रहा है, आपको छाती में धड़धड़ हो रही है, if you're getting palpitations overnight, you should get your echocardiography done. So valvular heart disease is such a thing. वो आपके ब्लड में कभी चेक नहीं होगा unless you do echocardiography. echo में हम हार्ट को अंदर से देखते हैं तो वॉल्स हमें दिखते हैं. तो अगर आपके वॉल्स में ब्लॉकेज है या आपके वॉल में कोई लीकेज है ये आपको echocardiography में पता चलेगा. और ये अगर आप अर्ली स्टेज पर डिटेक्ट करोगे तो ये मेडिसिन से ही कवर हो जाएगा. वो स्टेज प्रोग्रेस जल्दी होगा नहीं. और अगर आप मेडिसिन उसको अर्ली स्टेज पे नहीं स्टार्ट करते हो तो वॉल रिप्लेसमेंट का स्टेज बहुत जल्दी आ जाएगा. तो रूमेटिक हार्ट डिजीज डिटेक्ट करने के लिए आपको आपका एनुअल इकोकार्डियोग्राफी करना चाहिए. दूसरा एक सिम्टम है अगर चेस्ट पेन रहा तो अभी काफ़ी लोग अवेयर हो गए तो एटलीस्ट दे विल टेल कि यस आई एम गेटिंग चेस्ट पेन, दे गेट एटलीस्ट ECG डन. बट चेस्ट पेन के साथ में देयर कैन बी अदर अनयूजुअल सिम्टम्स इन फीमेल. जैसे यू गेट इजीली फटीग, थोड़ा काम करने पे थक जाते हैं जो पहले नहीं होता था. So, especially in diabetic females, this can be a very common symptom. So, they should get your echo TMT done and you'll understand whether there's underlying heart disease or not. Similarly, if you किसी के पैर पे suddenly swelling आ जाती है. So, again, this can be a cardiac symptom which you should get yourself a echocardiography done to get it evaluated. And second thing, if you are a diabetic, you may not get a symptom like a chest pain. किसी को अटैक आता है तो जो typical symptom होता है chest pain, sweating, किसी को बैक एक होगा, जॉ पेन होगा, किसी को लेफ्ट आर्म पेन होगा. These typical symptoms you will never get in a diabetic patient. उनमें क्या होता है, the first symptoms is usually breathlessness on exertion. थोड़ा चलने पे दम लगता है. तो ऐसे में हमें कार्डियक इवैल्यूएशन भी उतना ही ज़रूरी होता है. और डायबिटिक पेशेंट्स 70% डायबिटिक पेशेंट्स जो हम देखते हैं उनका 2D इकोकार्डियोग्राफी नॉर्मल होता है. ओके, टू डी इको विल टेल यू आपका हार्ट का पंपिंग नॉर्मल है क्या और आपके वॉल्स नॉर्मल है क्या. एंड हार्ट का पंपिंग, जब तक आपको हार्ट अटैक नहीं आएगा तब तक आपका हार्ट का पंपिंग नॉर्मल ही रहने वाला है. अगर आपको वॉल का प्रॉब्लम नहीं तो आपका वॉल नॉर्मल ही रहेगा. सो एक इको नॉर्मल है यानी आपको अंदर ब्लॉकेज है, ऐसा नहीं होता है. इसके लिए हम 4D इको में ग्लोबल लॉन्जिट्यूडनल स्ट्रेन कैलकुलेट करते हैं. तो वो आपको बताएगा कि आपके हार्ट पे स्ट्रेन है क्या. अगर ये जीएलएस आपका कम आता है यानी आपके कोरोनरी आर्टरी डिसीज में ब्लॉकेज हो रहा है. फिर हम पेशेंट को एंजियोग्राफी एडवाइस करते हैं. और दूसरा होता है कि हम उनको स्ट्रेस टेस्ट एडवाइस करते हैं. तो आपको ट्रेडमिल पे चलना होता है. ट्रेडमिल में जब पेशेंट चलता है तो हम ईसीजी में चेंजेस देखते हैं. तो अगर आपका ब्लड प्रेशर जब हम बढ़ाते हैं ट्रेडमिल पे चलते हुए, आपका हार्ट रेट बढ़ाता है, उसमें अगर आपके ईसीजी में चेंजेस है यानी आपके कोरोनरी आर्टरी में ब्लॉक है. तो हार्ट इको नॉर्मल है यानी हार्ट का पंपिंग नॉर्मल है यानी अंदर ब्लॉकेज है, ये ऐसा कंसेप्ट नहीं होता है. इसके लिए बहुत केसेस मिस हो जाते हैं. बस इको करते हैं इको नॉर्मल है और हम नॉर्मल है, ये करके बहुत सारे केसेस मिस होता है. तो इसलिए उसके साथ आपको एक तो ग्लोबल लॉन्जिट्यूडनल स्ट्रेन देखना है, नहीं तो आपका स्ट्रेस टेस्ट देखना
Right. तो आई थिंक एक होलिस्टिक वे में देखना बहुत ज़रूरी है रादर देन रिलाइंग जस्ट वन सिंगल टेस्ट.
है. एग्जैक्ट.
Right. And I think that's such a important point which you have mentioned. I mean, many times, जैसा आपने स्टार्टिंग में ही कहा कि women ignore their health.
Yeah.
वो घर के कामों में या फैमिली में इतना वो बिजी हो जाते हैं. इवन वर्किंग फीमेल्स आर सो बिजी that they tend to ignore their own health. And I think it is a very valid point that ये एक चीज़ है because health is wealth जो हम लोग बचपन से सुनते आ रहे हैं विच इज़ सो ट्रू.
डेफिनेट.
तो आई थिंक ये इग्नोर हमें बिल्कुल ही नहीं करना चाहिए विच इज़ वेरी राइट. बट एज यू एक्सप्लेन्ड दिस कुड बी सीरियस वार्निंग साइंस. आई बिलीव दिस मैसेज विल ऑल्सो एनकरेज women to take their symptoms more seriously.
डेफिनेट.
And I think self diagnose नहीं करना चाहिए.
एग्जैक्टली. इट इज वेरी
Always
इम्पोर्टेंट.
reach out to the expert is always needed. So ma'am, since we are talking about women's health, I also want to ask endocrine problems like thyroid disorders, PCOS, or even diabetes. We touched a part of it in the last question, but these are very common in women. So can you explain how these hormonal changes or disorders affect women's heart health at different stages of life?
राइट. फर्स्ट ऑफ ऑल हार्मोनल चेंजेस की बात आए तो मेनोपॉज, एक बार मेनोपॉज फीमेल्स क्रॉस कर लेते हैं, देयर रिस्क ऑफ डेवलपिंग हार्ट डिजीज इज इक्वल टू मैन. तो एक बार आपका पेरीमेनोपॉजल स्टेज हो जाए, आपका एनुअल हार्ट चेकअप बहुत इंपॉर्टेंट होता है. राइट. बिकॉज जो ब्लड में ईस्ट्रोजन प्रोजेस्टेरोन लेवल्स का जो मेंटेनेंस रेशियो रहता है, वंस इट गेट्स डिस्टर्ब देन योर blood levels, blood hormonal levels are the risk of getting a heart disease is equal to that of a male. So annual health checkup after menopause is very important. सेकेंड जो थायराइड के फीमेल्स होता है, तो हाइपोथायरॉइड अगर आप ट्रीटमेंट बराबर से नहीं ले रहे हो, टैबलेट्स आप कभी ले रहे हो कभी नहीं ले रहे हो, आप बार बार मॉनिटर नहीं कर रहे हो, आइडली व्हाट वी एडवाइस इज हर 3 महीने में आपको आपका अगर आपको हाइपोथायरॉइडिज्म है, एवरी 3 मंथ्स यू हैव टू चेक योर थायराइड लेवल्स, बिकॉज आपका जो हार्मोन है वो हमेशा फ्लक्चुएट होते रहेगा. तो आप एक डोज ले रहे हो, उसी पे आपका TSH T3 T4 हमेशा नॉर्मल नहीं रहने वाला है. बट इट शुड रिमेन नॉर्मल इफ यू वांट टू कीप योर प्रिवेंट द साइड इफेक्ट्स ऑफ हाइपोथायरॉइडिज्म. जैसे हार्ट की बात की तो हाइपोथायरॉइडिज्म में सीवियर हाइपोथायरॉइडिज्म में तो पेशेंट को पूरे बॉडी पे स्वेलिंग आते हैं. सेकेंड सिम्टम इज अगर किसी को हाइपरथायरॉइडिज्म है तो उसमें पाल्पिटेशंस होते हैं पेशेंट्स को, किसी को एट्रियल फिब्रिलेशन भी होता है. So in all these cases, keeping your thyroid levels is normal is very important. Severe hypothyroidism में किसी को पेरिकार्डियल इफ्यूजन होता है, हार्ट के बाजू में पानी जमा हो जाता है. So this will, a 2D echocardiography will tell you. Right. जहाँ तक डायबिटीज़ का सवाल है, डायबिटिक पेशेंट्स में हर 3 मंथ्स में HbA1c कंट्रोल होना ज़रूरी है. राइट. फास्टिंग पोस्ट मील तो आपको मंथली करना है. इसके सिवा आपको 3 मंथली HbA1c, जितना आपका HbA1c कंट्रोल रहेगा, आइडियली HbA1c शुड बी लेस देन 6.5 इफ यू आर अ डायबिटिक पेशेंट. वी कॉल इट कंट्रोल ओनली व्हेन इट इज लेस देन 6.5. अगर वो 6.5 से ऊपर जाता है, आपकी धीरे धीरे आपके कोरोनरी आर्टरीज में ब्लॉकेज होने चालू हो जाता है. दिस इज व्हाट वी सी इन आवर डेली एक्सपीरियंस. मैंने कितने पेशेंट्स, अगर आप बाईपास के पेशेंट्स देखे तो 90% पेशेंट्स दे आर डायबिटिक. So see now this 90% is a very big ratio. And why it occurs? Because the HbA1c levels are not controlled. Maximum patients के HbA1c 10, 11, 9, that is how it is. And the patients reach the stage directly of a bypass. यहाँ आपके तीनों आर्टरी में blockages हो जाए. दूसरा होता है, इवन बहुत लोगों को लगता है कि मेरा HbA1c 7 से 9 के बीच में है, सो इट इज़ अ कंट्रोल. इट इज़ नॉट कंट्रोल. लॉन्ग अगर आपका HbA1c हमेशा 7-9 के बीच में रहेगा, तो कभी ना कभी आपको एंजियोप्लास्टी लगेगा. दिस इज व्हाट आई एक्सपीरियंस सेज, बिकॉज धीरे धीरे वो अंदर साइड इफेक्ट्स होने चालू हो जाता है. क्या होता है डायबिटिक पेशेंट में, अगर हम जब भी एंजियोग्राफी करते हैं, उनके वेसल की साइज बहुत छोटी हो जाती है. तो बिकॉज आपके शुगर लेवल्स अनकंट्रोल्ड रहते हैं, धीरे धीरे आपके वेसल की साइज कम होते जाती है. और उसमें जब वो प्लाक डिपोजिशन होता है तो जल्दी से स्टेनोसिस हो जाता है, और पेशेंट को एक तो एंजियोप्लास्टी लगता है, नहीं तो बाईपास लगता है. इसलिए डायबिटिक पेशेंट में एनुअल स्ट्रेस टेस्ट बहुत ज़्यादा है, और HbA1c कंट्रोल रखना भी इम्पोर्टेंट है. एंड डाइट इज इक्वली इम्पोर्टेंट फॉर अ डायबिटिक पेशेंट. कि आजकल जैगरी, गुड़ की चाह, दिस इज व्हाट इज getting famous. But for a diabetic patient, good is good for your health, no doubt. And if you're a diabetic, whether it is jaggery, whether it is sugar, whether it is khadi shakkar ho ya brown sugar, any sugar it is not good for your health. If you're a diabetic, you have to completely go on a no sugar diet. This is very important. Only then your HbA1c levels will remain in control. Fruits also, what we advise in diabetic patient, most of the fruits, they will increase your blood fructose levels, and they are going to increase your blood sugar levels. So what we advise is apple, pomegranate, kiwi. Only these are some of the fruits, and sometimes citrus fruits. So these fruits only a diabetic patient should consume in regular. Less fruits you can consume once a week, but not more than that, because they are going to increase your blood sugar.
Yeah, right. So, ma'am, also we keep on hearing, rather than fruit juices, you should go for whole fruits.
So again, the thing behind it, when it's a fruit juice, every time you won't, it won't be a house-made, a homemade thing. Again, there will be preservatives. Again, there will be a sugar added in that. So we don't want that stuff. Whatever things, how much fresh you will eat, that much your heart will remain healthy.
Okay, got it. So that's something, we don't hear often when you correlated, diabetes, thyroid, or even hormonal problems along with heart health. I think that's a very important point. We usually think of, thyroid or diabetes as very separate issues, and we never try to, correlate or interconnect. But the way you explain shows how deeply they are connected to heart health. And the data is really shocking that in your clinical experience, almost 90% of the cases are diabetics. So that's something which is very scary, I would say. So it makes me realize that women need to be even more careful during different stages of life, from young adulthood to menopause, because hormones also will play such a big role for overall, heart risk.
Right. And taking, OC pills and all these hormonal pills by themselves, hormonal pills, they always have a thrombotic side effects. So we have seen that female patient developing deep vein thrombosis or some artery getting suddenly blocked. कोई हाथ की आर्टरी बंद हो जाती है, किसी के पैर की आर्टरी बंद हो जाती है. So these thrombotic tendencies increase when you take unnecessary hormone pills.
Right, right, right. Ma'am, another important issue for women is gestational diabetes during pregnancy.
Right.
So, could you explain what exactly it is, how it affects both mother and the child, and whether it has any long-term impact on mother's heart health?
Gestational diabetes, say this diabetes in most of the cases, in first time in the pregnancy, the female gets diagnosed to be diabetic. So what happens basically is when the blood glucose level remains consistently high, it is going to cause the fetal hypoglycemia also, and then the fetal side effects develop. It is usually a macrosomia, like a high birth weight baby. So all these side effects, both long-term risk is there for the the mother. There will be a long-term risk that she will develop diabetes in future. She'll have to follow diabetic diet and may even take either oral hypoglycemics or insulin in future also.
Right.
And both the baby also, he has a risk that he may develop in future, he may develop diabetes. So basically what is important is you should, once you're diagnosed with the gestational diabetes, in your long-term life also you follow how much diabetic diet you can follow, that will be better for your heart.
Right.
Because once you develop diabetes again, there will be always a 10% risk that that mother will develop in future again diabetes. Okay, so what will happen? Again, the side effects of diabetes will start on their health. So it is, as we know, it is a multi-organ dysfunction. Diabetes may cause stroke in some patient. It will cause hypertension in some patient. It will cause albuminuria and then some kidney problem in some patient. And never to leave, it will cause a heart problem in patients. So how much your HbA1c levels will remain controlled, that much your heart will remain healthy.
Right. Yeah. So that's something I think काफी families कोई awareness ही नहीं है. What you just explained. Many people will only assume that pregnancy diabetes just disappears after the delivery. It's not
Exactly.
true, right? So, but the way you explain it can actually raise risk for the future.
Yes.
So this really highlights why it needs more attention and should not be
Exactly.
taken very casually. Ma'am, doctor, diabetes often puts extra strain on the heart, uh, as we have gathered from what you said. Could you share some practical tips or daily habits that diabetic patients can follow to keep their heart healthy, especially women, if there is anything different for them to follow?
Exactly. First of all, as a female, a diet of the family and diet of yourself is in your hands. So strictly you should follow a no sugar diet.
Right.
Second, 3 monthly you have to get checked your HbA1c level. Third important point what women neglect is exercise.
Right.
Right? So just a 30 minutes walking if you do. If you don't get time, 30 minutes in the morning, 15 minutes in the morning and 15 minutes in the evening. This much also time if you take for yourself, it will help to keep your sugar levels, your hormonal levels under control. So diet is one thing, annual checkup is one thing, right? So compulsory if you're diabetic, you have to get your ECG, ECO and TNT annually.
Right. Okay. Now, we hear this very commonly. And I think this is something which I should ask. I mean, who better than you answering this? Many females, they feel that, the household work that they do is equivalent to the exercise, to what is recommended. So, is it really the same or we should keep it different? What is your take on that?
No, definitely not, because when you exercise early in the morning, it helps your capillary blood circulation to increase. It will increase the oxygenation into your peripheries.
Right.
And this will help to keep your heart and your microcirculations healthy. So doing this in that fresh air is
Important. Okay. I think this is a very important message for all.
and nowadays we get so many videos on also on the YouTube when you're working in the kitchen, how you can do exercise simultaneously, which will really help to keep yourself healthy. So workouts, what we call.
Right.
So kitchen workouts also how you can search nowadays in the
Okay.
YouTube. So there's a different form of workout which will help you to keep your heart
Right.
healthy. Right?
Okay. That's very interesting. I wasn't aware of it. So kitchen workouts are something which females can look out for. Right. That's really insightful. I mean, I think these are the small, consistent habits, that truly makes a big difference in preventing, heart complications. Uh, Now, you briefly mentioned, and we have often heard the term called as 4D echo.
Yeah.
We on and off keep on hearing, any person in the family has got it done, 4D echo. So, for a common person, can you explain what exactly is 4D echo, how it works, and who would need it?
Exactly. So, for in 4D echocardiography, first of all, for the valve patient, it is the best echocardiography. जिनको wall का problem होता है. In females, the wall problem is very common. And nowadays, what we observe, degenerative wall disease has also become equally important. Above 60, if I do the echocardiography of 10 patients, 6 of them will have some wall leakage.
Okay.
And this leakage will be detected only on your echocardiography. So if you detect it at an early stage, you won't have to go to that wall replacement stage, right? So in 4D echo, what a surgeon sees the valve on opening the heart, that wall you can see directly on the 4D echo. So it shows the structure and morphology of the heart from inside.
Okay.
In 4D dimension,
Right.
right? Second, in 4D echocardiography, we calculate GLS, that is the global longitudinal strain. So nowadays, after 50, there are so many females and even males, they will have some form of osteoarthritis of the knee, and they won't be able to walk on the treadmill, right? See, stress test, it is useful only when when you complete the stress test. If you don't complete all the 3 stages of the stress test, it is inconclusive. It is not going to give you any important information, right? And obesity is also so common nowadays. So most of the obese patients, they are not able to complete the stress test. They have to stop at stage 1 or 2 only because they become breathless. So in all these patients, we recommend. In females, osteoarthritis is very common. So they also cannot walk on the treadmill. And as I already told you, a simple 2D echography, it will be normal. Your, unless you get a heart attack, your pumping is going to be normal. If you don't have any wall problem, your 2D echocardiography is going to get normal. So heart pumping is one thing, and the blood supply to the heart is another thing. What you get a heart attack is when the blood supplying the vessel which supplies the blood, that gets blocked, that causes the heart attack, right? So what our ultimate aim is, we want to detect the blockage in this blood vessel.
Right.
And this only either a stress test or a global longitudinal strain is going to tell you. So in 4D echocardiography, the accuracy of global longitudinal strain is very high. And so it will tell you which part, in heart, there are 3 important blood vessels, 2 on the left side and 1 on the right side. So in 4D dimension, it will tell you okay, which part of your heart is under strain, means where a significant blockage is there, whether it is on the LAD territory, L6 territory or RC territory, that the whole thing that GLS will tell you. So normally minus 15% or less is abnormal. Anything above minus 15 is normal. So routinely I do global longitudinal strain in my all echocardiography patients. So on echocardiography only I can tell them whether you are having a significant coronary artery blockage or not.
Wow.
So if this your GLS comes less than minus 15, we correlate this in our daily practice. But those patients where the GLS comes less than minus 15, we advise them an angiography, and we can see a significant blockage on angiography. So the advantage is you pick up the blockage at early stage.
Right.
So maybe you may just need medicine, or maybe you may need angioplasty in a single vessel. You don't have to go in that stage where you will get all your three vessels blocked and you'll have to go bypass surgery. Right?
Okay. So honestly, we already imagined it was some complicated machine, but now I understand it's more like an ultrasound of the heart, but that gives a better clarity than conventional 2D echo. So it's reassuring to know that it's safe, quick, and gives such vital information.
Exactly.
We also hear about advanced procedures like TAVI, especially for patients and with valve problems. Can you explain in simple terms what TAVI is and in what kind of patients it is usually recommended?
Exactly. TAVI, that is transcatheter aortic wall implantation. यानी aortic wall जब आपका खराब हो जाता है, there are two types of wall problems. One is aortic stenosis, यानी wall block हो जाता है. Aortic regurgitation, यानी wall में leakage हो जाता है. So whenever this becomes severe, a severe aortic stenosis or a severe aortic regurgitation, what we have to change is you have to change your aortic valve. That is the ultimate treatment. Otherwise, the patient's life is always at risk, right? So a symptomatic severe aortic stenosis or regurgitation. Now what happens is when you do open heart surgery for wall replacement, there is always a 10% risk of perioperative risk for the patient, right? This is what the studies have shown, and with age, this risk keeps on increasing, right? So after 65 years of age, instead of going for an open heart surgery for a wall replacement, we give the option of TAVI, that is transcatheter aortic wall replacement. So यहाँ पे क्या करते हैं, जैसा it is same like angioplasty. Angioplasty में हम क्या करते हैं, इधर बाय हैंड, इधर बाय रेडियल और फीमोरल, यानी पैर से हम स्टेंट डालते हैं हार्ट तक. तो इसमें भी हम वही कर रहे हैं. हम फीमोरल आर्टरी से, आपके पैर के आर्टरी से स्टेंट की जगह हम वॉल लेके जाते हैं. वो वॉल्व आपके अयोटा में जाके, जहाँ आपका अयोटिक वॉल्व होता है, वहाँ पे वो वॉल्व, उस पुराने वॉल्व के अंदर नया वॉल्व बिठा देते हैं. So TAVI is a boon for patients of aortic stenosis. So in our experience, what we have seen, we just recently had a 90-year male patient. This he presented to us with atrial fibrillation, यानी उसका heart beat पूरा abnormal हो चुका था. Severe breathlessness, and he couldn't walk from year to year also, right? And his age was 90. So and he, when we did an echocardiography, he had severe aortic stenosis with a moderate aortic regurgitation. यानी block भी था, leakage भी था उस wall में.
Right.
And the main reason for all his palpitations and his breathlessness was the wall problem. लेकिन इस एज में ऑपरेट करना was impossible for him. So we gave him this option of transcatheter aortic wall implantation, and the relatives were also eager that they wanted to save the life of his grandfather. And you will see the miracle. As soon as we did the TAVI, we did the aortic wall replacement. On the day 3rd, he walked the stairs of the hospital. So that miracle the transcatheter aortic wall implantation does. So immediately your wall, you get a new valve, which is so. Basically, what happens in aortic stenosis is, this is the main valve with which the heart pumps the blood through the whole body. राइट. तो अगर यही ब्लॉक हो जाता है तो आपको पूरे बॉडी का ब्लड सप्लाई ब्लॉक हो जाता है. सो एज सून एज यू, एंड बिकॉज ऑफ दैट अगेन द पंपिंग ऑफ द हार्ट रिड्यूसेस. जैसे हमारे पेशेंट का द पंपिंग वी हैड रिड्यूस टू 35%, राइट. जो नॉर्मल पंपिंग 60% होता है, इट हैड कम डाउन टू हाफ. That is why he was getting breathlessness. As soon as we opened up the valve, the heart functioning improved, and now he is having a normal pumping of his heart.
Wow. I think listening to you, it really feels that technology has really advanced. I mean, the idea that a major heart valve problem can now be solved and treated without open heart surgery itself is so amazing. I mean, even a 90-year-old can go through, which means that is something which is new credit to technology and the practitioners who are
Exactly.
following it. I'm sure many families will feel hopeful hearing about such options which are now available with them,
Yeah, definitely.
right? Ma'am, one term which comes up a lot in emergencies is primary angioplasty. Uh, can you tell us what it means and why it is considered so important when someone has a heart attack?
Yes, this is actually a very neglected part which general public uh, mostly are not aware. प्राइमरी एंजियोप्लास्टी यानी जब आपको हार्ट अटैक आता है उसके 2 से 3 घंटे के अंदर आपकी अगर एंजियोप्लास्टी हो जाती है, बेसिकली हार्ट अटैक पेशेंट को कब आता है जब उसके हार्ट की जो आर्टरी रहती है वो 100% बंद हो जाती है। वो बंद होने के कारण आपका उतना हार्ट का पार्ट जो वो आर्टरी सप्लाई करती है वो पंपिंग कम हो जाता है,
राइट।
राइट? तो हार्ट आपको एक 2 से 3 घंटे का टाइम देता है, अगर उतने टाइम में अगर वो आर्टरी आपकी खुल जाए, इट विल सेव द पंपिंग ऑफ योर हार्ट। Okay. And what happens is, usually, can cut this part, huh, where I go. अगर आपके पास पेशेंट 2 घंटे चेस्ट पेन के 2 घंटे के अंदर आता है तो हम तुरंत उसको एंजियोप्लास्टी करके वो ब्लॉकेज खोल देता है। इट इज़ वेरी सिंपल। अगर आपका आर्टरी बंद है, ऐसा आपका अगर पाइप बंद है, जब तक वो आप कचरा निकालोगे नहीं उसमें से, तब तक उसमें से पानी आने वाला नहीं है। द सेम थिंग होता है हार्ट अटैक में। आपकी आर्टरी 100% बंद है, तो हम बेसिकली एंजियोप्लास्टी में क्या करते हैं, हम बलून से वो ब्लॉक को खोलते हैं, देन वी पुट अ स्टेंट इनसाइड, तो वो आर्टरी नॉर्मल हो जाती है। सो अगर आपको आपका हार्ट का पंपिंग बचाना है तो पहले 2 घंटे इज वेरी इंपॉर्टेंट फॉर हार्ट पेशेंट। उस उस दो और यही अगर आप सिर्फ स्ट्रेप्टोकाइनेज जैसा इंजेक्शन जो ब्लड थिनर बोलते हैं, सिर्फ अगर आप पेशेंट को उतना देते हो, तो ओनली 60% चांस होता है कि आपकी आर्टरी खुलेगी।
ओके।
40% योर हार्ट इज ऑलवेज एट रिस्क। और प्राइमरी एंजियोप्लास्टी अगर आप 2 घंटे में करती है, that is going to 100% open your artery and your pumping will safe. एक बार आपका हार्ट का पंपिंग कम हो जाए वो हमेशा के लिए कम रहता है। और एक बार आपके हार्ट का पंपिंग कम हो गया, इट इज डेफिनेटली गोइंग टू रिड्यूस द लाइफ स्पैन द पेशेंट। तो अगर आपको पंपिंग नॉर्मल रखना है हार्ट का, और अगर हार्ट अटैक के पेशेंट में हार्ट का पंपिंग नॉर्मल रखना है तो वो पहले 2 घंटे में उसकी आर्टरी खोलनी चाहिए। So this primary angioplasty is very important. So you should, if you are saying in a place wherein a cath lab is there, then the patient should go in a hospital where already a cath lab is there and get his primary angioplasty.
Right, right. So these 2 hours are very critical where we need to reach out uh, to the expert. I think that explanation will stay with all of us. I mean, the way you put it, angioplasty sounds like opening a blocked road so traffic can move again. But here it's, blood flow that's being saved.
Exactly.
So it really makes me realize, how crucial it is to reach the hospital quickly when someone has chest pain and not self-diagnose. That is not the time to, Google or chat GPT. It's time to, without thinking any such symptom for yourself or anybody around you, it is important to reach the nearest healthcare facility and specifically, if possible, when there is a cath lab available.
Exactly. What you as a relative can do for a patient, if somebody collapses in front of you and gets a heart attack, and the chest pain, you should give him Ecosprin 75 mg, 4 tablets of Ecosprin 75 mg, and 4 tablets of clopidogrel 75 mg. So 300 Ecosprin and 300 mg of clopidogrel and 80 milligrams of atorvastatin. If you are giving a patient of a heart attack immediately when he gets the heart attack, you will at least prevent the mortality of that patient, which is always a risk when a patient gets suddenly a heart attack.
Okay, okay. So I think that's something, a very important message that you have given to put the end of this fantastic conversation that we are having. And I think these 3 medicines which you have mentioned as a loading dose can, if it can ensure that there is no mortality, I mean, these are life saving ultimately.
Exactly.
So we should always keep it as a part of our
Yes, in your home and in your traveling kit, you should always have this.
that's very, very important. Uh, Ma'am, this has been such an insightful conversation. We have learned, how prevention is the foundation, how women face unique risks through hormones and pregnancy, and how modern treatments and technology and quick action in emergencies can save lives. If there's one clear message today, it is that awareness and timely action are the strongest medicines that we have. Take small steps each day because a healthy heart leads to a healthy life. Thank you, ma'am. It is indeed a very enriching conversation, not only for the viewers, for me personally as well. Thank you so much.
Thank you so much. I hope this conversation will help many people to keep their heart healthy.
Absolutely, ma'am. We are very sure of it. And thank you so much for your time and being with us for Azkka podcast.
Thank you.
Thank you.